Jar Oil. The company have filling stations across the country, and our rates are relatively cheaper than anyone else across the country. Jar Oil is the biggest producer and distributor of cement in the country with the most competitive prices in the market.
Excellent jams, Wave.
Yo, apply. Yo, luta do dede. Luta mo nulo jël moto nga andil ma xaalis. Hello?
Busel mu fine.
What?
Busel mu fine.
Oh, yes!
Wave acts in Gambia. Deposit and withdraw money, pay bills and buy mobile credit without fees. Transfer money wherever in the country for only 1% fee. At Wave, Busel mu fine. Wave, your money is yours.
Welcome to our first Pink October Conversation, a special series dedicated to raising awareness, sharing knowledge, and inspiring action in the fight against breast cancer. October is globally recognized as Breast Cancer Awareness Month. And here in the Gambia, West Coast Radio and Comium are joining the movement with voices that matter, the voices of our medical professionals, survivors, and advocates. Each week, we'll sit down with one or several of these to unpack the facts, dispel the myths, and explore how early detection, treatment, and support can save lives. And we kick off this morning with our first three guests from the Edward Francis Small Teaching Hospital, the country's main referral hospital in Banjul. They are here to help us understand the basics of breast cancer, yes, but also cervical cancer or cervical cancer, and why early detection is so critical. First, the introductions. And since they say ladies first, the lady nearest to me to my left.
Good morning, Uncle Peter. Thank you for having us. My name is Dr. Fatmata Jite. I'm a medical officer at the Edward Francis Small Teaching Hospital.
Welcome, Dr. Jite. We were here last year.
Yes,
Thank God we're back here again.
It's been a year.
It has been.
It's good to see you again.
Good to see you again. And well, let's welcome for the first time to Coffee Time our next invited guest from Ed Francis Small Teaching Hospital.
Thank you, Mr. Peters. Good morning, everyone. Good morning, listeners. Good morning, Dr. Roberts, my boss. Good morning, Dr. GT. Thank you for having me. My name is Dr. Rohi Jaju, working at Edward Francis Small Teaching Hospital at the Obstetrics and Gynecology Department.
Thank you. Welcome. Well, you partly introduced him, so we'll let him do the rest of the introduction. Welcome back. We were here last year, weren't we?
Thank you very much, Peter. Good morning, listeners. Good morning, everyone. My name is Dr. Charles Roberts. I'm a senior consultant general surgeon at the Edward Francis Small Teaching Hospital.
Okay, let's start with the basics. Dr. Jite, what are the most common symptoms of breast cancer?
Okay. The most common symptom of breast cancer is a breast lump. A lot of the women present with a breast lump first. There are other symptoms, but that is the most common. That doesn't mean every lump is cancer, by the way. It just means that every lump needs to be checked because it's a very common symptom of breast cancer. There are other symptoms like nipple discharge or inverted nipple. That too, not everybody and not every inverted nipple is breast cancer. Some women naturally have inverted nipples. So it's a new inverted nipple that was not there before that you need to get checked out. Okay. And then enlarged breast. The breast can, one of them especially, can just start to grow faster than the other. That too, not every breast enlargement is breast cancer. Naturally, one of the breasts is bigger than the other. But if you just see one of them outgrowing the other, or maybe starting to have skin dimpling, meaning there are holes puckering in the breast, you need to get it checked out. So yeah, there are others, nipple discharge, there are a lot of symptoms. So
a bit confusing. This is a sign, but it does not mean that every sign is breast cancer. Dr. Roberts, you want to add anything to that before I move on to Dr. Jaju, who is a cervical cancer expert here?
Yes, the only thing I want to add is that the breast lump, the peculiar thing about the breast lump in breast cancer, like in the most common presentation, is that it's painless. And because of that, people don't tend to come to the hospital early. because it's just a lump in the breast. They feel something, say, well, maybe it might go away. And they leave it until it starts getting bigger, starts forming an ulcer, and starts having pain. Then they come to the hospital.
Okay, when it would have been too late, perhaps.
Yeah.
All right. And Dr. Jaju,
Yes.
what are some of the most common symptoms that women need to be aware of when it comes to cervical or cervical cancer?
So for cervical cancer, it's a cancer that develops in the cervix. In layman terms, we can say it develops from the opening of the womb. So initially, there are no symptoms.
No symptoms?
Yes. As it starts, you may not experience any symptoms. So that's why it's important to do the screening to detect the abnormality and then get treated before it develops to a cancer. So the other symptoms that can develop when it's maybe too late or the cancer has already developed, it's having vaginal bleeding. That is outside your normal menstrual period. You can also have postcoital bleeding, that is having vaginal bleeding after having sex, or pelvic pain, or abnormal vaginal discharge, which is very foul smelling. Yes. Those are the symptoms.
And in terms of the risk factors, what are these, age, genetics, lifestyle? How do they contribute to these these cancers? If I may start with you, Dr. Roberts, on breast cancer.
Yes, thank you very much. For the risk factors, again, I would like to say what Dr. Jite has been saying. It's not, if you have the risk factor, it doesn't mean that you're going to have breast cancer. So the risk factors just put you at a higher risk of having breast cancer. And we tend to group them into modifiable and non-modifiable. Modifiable meaning that you can do something about it, and non-modifiable meaning that you can't do anything about it. I'll start with the non-modifiable ones, like your age. I mean, everybody grows old, so you cannot
We all wish we could modify our ages.
You cannot change that.
Yeah.
And then you have some genetic factors. Genetic factors also, you cannot do much about it. There's this BRCA gene 1 and 2. Mutations in that gene can put you at a higher risk of having breast cancer. Then you have the menstrual history. Some people start seeing their menses very early, maybe around 10 or so. That's what we call early menarche. And then you have late menopause. So all that exposes your breast to the hormones for a longer period. Okay, those are non-modifiable. When we come to the modifiable ones, you have things like the lifestyle, obesity, and smoking. All of those things are known to be risk factors. Using oral contraceptives, those you choose to do them. And maybe I might just add about the oral contraceptive, the risk is only slightly increased. So, I mean, I'm not saying that people shouldn't use oral contraceptives, but now they even have this mini pill, which is even less, it has a lesser risk of breast cancer. Or maybe after menopause, some people start using this hormonal treatment, replacement therapy. So all of those things increase the risk. They are modifiable. You can choose not to do them. And then you decrease your risk.
Dr. Jite, you want to add to that?
Yeah, so when we do advocacy, we basically target the modifiable ones, like your weight, like your taking of certain drugs that can increase your risk. We go after exercise, your diet. Those are the ones that we target. And definitely early detection. There is no prevention for breast cancer, no known prevention yet, no vaccine yet, but early detection is the way to go for both breast and cervical cancer. Like Dr. Giorgio said, in cervical cancer, you can't even, sometimes it's asymptomatic. You need to go and do an inspection of the cervix to see, and that only a healthcare worker can do. So the early detection, the prevention, the advocacy is also women can come and screen on time. And that's what we sing in the hospital the whole year round. It's just in October we come and meet you so that we can have the general population involved in the conversation.
And Dr. Jaju, same question. How do, risk factors like age, genetics, lifestyle contribute to the development of cervical cancer?
Okay, so because cervical cancer is caused by a virus called human papillomavirus, so which is sexually acquired. So any woman that is sexually active is at risk of developing the cancer. Yes. So that's why we advocate for any woman that is sexually active to come for cervical screening. So which will detect the precancerous lesion or which will detect the virus and then get treated so that it will not develop into cancer. Yes.
And in all this, apparently, timing is important. Why is timing important, Dr. Jite? Why do women need to come early to, the hospital if they feel a lump in their breast, to be screened for breast cancer?
Yeah, Uncle Peter, it's all diseases. The earlier you come, the better it is, especially for the chronic diseases, cancers, and malaria, likewise. Every disease, the earlier you come, the better. In malignancy, like Dr. Robert said earlier, it's not painful. We wish it was painful. If the lumps were painful, we would stop coming to the radio. Early detection will be history, because there is another condition called mastitis. That one is painful. It's not cancer. It's painful. A woman come, they're like 2-3 days, it started paining, and now I'm here. So if the lumps were painful, we know that everybody would rush on time. The thing with it is there. It's painless. You're touching it. It's getting bigger. It's maybe, especially for breastfeeding women. A lot of people say it's the baby that burped on the breast. So breastfeeding women can also get cancer because of all the excess hormones that the body has to shoot up to take care of that baby. So you feel a lump. It might be other things like lactating mastitis and all that. It can be an abscess. But a breast lump that's malignant is also a differential diagnosis. So the earlier you come, the better we take it out. Sometimes if it has not spread, we just take the lump out and throw it. But if you don't come on time, that's when it has spread to all the nearby tissues, the axillary lymph nodes, and spread to other organs like the liver, the bone, the brain, the lungs. We cannot remove those. It's not possible to remove those organs. So it's important to come when the lump is still small and still within the breast. So doctors like Dr. Roberts can just pick out the breast lump and take it to the lab, check it, confirm if it's malignant or not. If it's not malignant, okay, we are good. We just continue doing self-breast examination. If it's malignant, then there's a process they take you through.
Well, Dr. Robert, you said there's no cure. There's no known cure yet for cancer. So coming early or not, if it's there, you're bound to live with it for the rest of your life. So maybe you just want to expound on this timing issue from an angle that Dr. Jite hasn't touched.
Yes. So for cancers, now some of the cancers like breast cancer, cervical cancer, when you come early, they're actually curable.
Oh.
Yes. So because it's still limited to that tissue and it hasn't spread to the other tissues. Like Dr. Jite said, it can spread in 3 main ways. It can spread to the surrounding tissue, it can spread through the lymphatics, to the lymph nodes, and it can also spread through the blood to the different distant organs, like the brain, the chest, and all those things. So if it hasn't done that, if it's still within the breast tissue and is still small in size, you can actually cure it. There are different methods of curing. Maybe we'll come to the treatment part. But at that point, surgery and maybe chemotherapy can cure that one. But then when it gets to the advanced stages, where it has spread, then the cure is very unlikely. And unfortunately, that's the case for most of our patients that come to the hospital.
And what's the situation with cervical cancer, Dr. Jaju? Is timing important as it is
very,
in the case
very
of
important. It's sad that we are losing a lot of women from cervical cancer because it is something that is curable and it's preventable. So the screening is very important. You come for screening. Once you start having sex and then you are sexually active, you need to come for the screening so that if any precancerous lesion is detected or the HPV virus DNA is detected, then it can be cured. So because it has a very long latency phase, you have a chance of curing the disease before it develops to cancer. So the other thing is that we have other ways of preventing it because a vaccine is available. We have the screening methods, the different screening methods that are available throughout the country, even though the sophisticated ones are only available in the hospital, that is Edward Francis Small Teaching Hospital. But we have other screening methods like the visual inspection on the acetic acid, which is available throughout the country. So the problem with Gambians is that women are not really ready to go and then do regular checkups with their body. Or some of them don't have the patience to go and then wait. That is the biggest problem that we are facing with women in this country, or even other people like men. So they don't usually want to come and then wait. They only prefer, if they have certain issues or have certain problems, they go to the pharmacy, just go and buy one medication or two, and then go back to the go back home. So they don't like coming to the hospital and then queuing, doing certain investigations, because most of them that are voluntarily coming for the screening are not many. So maybe in a week or in a day, we will have maybe 10 or less than that are voluntarily coming for the screening. So we take the opportunity of those that are coming to the clinic with other conditions. So once you are in the clinic, we take that opportunity and try to screen you, speak to you about cervical cancer, and then tell you that there's a screening that is available. So we took that opportunity, screen them, and then see what the outcome of the results will be. So from that screening, once it's detected that it is precancerous lesions, because before it develops to the cancer itself, it takes a very long time. So if it's a precancerous lesion, there are modalities or there are things that are available in which we try to treat that precancerous lesion, either to do certain treatment for you, like the cryotherapy, or do lip for you, or if it is an early stage disease, like Dr. Roberts mentioned about the breast cancer, we just remove the womb together with the cervix, and then you are free from the cancer. So but if you come too late, like what we are seeing, it's just going to be catastrophic, because it is the commonest gynae condition that is admitted in our gynae ward, and what is the most common cause of mortality in our gynae ward. Okay,
so Dr. Jite, I mean, how often should women undergo checkup in a year, and from what stage? From what age, rather?
The age, Uncle Peter, in all over the world, people are talking about starting for breast cancer screening at 40, 50. We are seeing patients at 20, 25, 23.
Really?
So, yes.
With breast cancer?
With breast cancer. Oh. Yes, I think there's even a younger child, a younger teenager that came with that.
We always thought that was the quote-unquote untouchable age.
Yes, so I don't know what's happening to us, but we need to wake up faster than everybody else, than the rest of the world, because we can't wait for them to come and meet us here. We know our realities, and we need to start tackling them sooner. We cannot say screening should be at 40 for breast cancer. It doesn't make sense when your patients are presenting at 25, 24, 23. So it's basically screening should be, for me, I think we can go to 18, Dr. Roberts, 15, 18. I'm not really sure which age, because
you should go for screening.
Yeah, so we advise even if you can't come to the hospital, there is something called self-breast examination. It's good to know how to examine your breast. There are videos on YouTube. There are videos. Just type self-breast examination. You'll be able to follow the steps in which they will show you how to do it and how often to do it. Usually we advise once a month at least for self-breast examinations, but we do have a different reality.
At least 12 times a year.
Yes, at least you check yourself. And then once a year, if you can go to a healthcare worker to check it for you, then they can show you some of the ways to do it, because that's the other advantage of coming for a health screening. They would do it and you would see how they're doing it, because those have gone through training, they know what they're doing, so they can show you how to do it. Because some people can just do it thinking they're doing it right, but they might just be poking and missing out some lumps that might be in the breast.
And what screening methods are available in the Gambia for both breast cancer and cervical cancer? Let's start with breast cancer, since this is October.
Yes, okay. Like Dr. Jita said, I think the self-breast exam is the first one. And the more you do it, the better you become, and you're able to pick up even smaller lumps. So we advise women, especially starting from the age of 20. I know our pediatric surgery colleagues have also operated on a girl with breast cancer, and in the hospital.
At what age?
Pediatric surgery is below 15.
Below 15.
Yes. Wow. So I mean, it's scary, but we are seeing them younger and younger. But yes, from 20, we advise women to do self-breast exam. Get to know how your breast feels like. So anything abnormal, you'll be able to detect it early. Then we have the clinical breast exam that's being done by a physician or health personnel. And then you have this radiological screening. That's you have the ultrasound for younger women, usually below 40. They say because the breast is a bit dense, so we tend to use more of the ultrasound scan. Then above 40, we have mammogram. You can do mammogram screening. And then if you detect anything, then you can go on to the histological diagnosis, because it's usually a triple diagnosis, clinical, radiological, and histological. So if you detect a lump, you can actually do some histological investigations. The most least invasive one is the fine needle aspiration. They just take a fine needle and then inject the lump and then get some of the cells from the lump and look at it under the microscope to confirm whether it's a breast cancer or it's not. It's actually more, it's better if you do it under ultrasound guidance so that you can detect which area looks suspicious and then you get cells from that. The other one is what we call incisional biopsy, where you take a piece of the lump together with the normal tissue so that you can be able to compare it and then look at it under the microscope. Then the last one is the excisional biopsy, where you take out the whole lump and then send it for examination in the lab. So we're able to do all of those in the hospital.
Fantastic, fantastic. And for cervical cancer?
Okay, the screening methods that are available are the ones I mentioned earlier, like the visual inspection under acetic acid. That's the VIA, which is available throughout the country, even in some private facilities. We also have the HPV DNA detection, which is a machine that was donated by Go.Go from the US. So currently we are doing it for free in the Edward Francis Small Teaching Hospital. And we also have the pap smear, which is also done in Edward Francis Small Teaching Hospital and few other health facilities. So those are the ones that are available for the early detection of the precancerous lesion. We also have the colposcopy machine, which is donated by China Aid. So this machine is the one that magnifies the cells within the cervix, and then a tissue can be taken from it called the biopsy, and then it is taken to the lab for confirmation. These are the screening methods that are available. You keep
making reference to HPV. Explain the role of HPV in cervical cancer.
Yes.
And the importance of the vaccine.
Yes, it's a virus. It's called human papilloma virus. So it is sexually acquired. So it is the cause of the precancerous lesion. It is the one that causes the abnormality within the cervix, and then these abnormal cells will invade the wall of the cervix, and then from one abnormality will mutate to abnormal cells and then will cause the cancerous lesion. From normal will mutate to abnormality and then will end up causing the cancerous cells.
Let's now come to myths. I mean, as Africans, we believe in myths. What are some of the most common myths about breast cancer, Dr. Roberts, if you may start with you?
Well, okay, I'll start with some of them. Some of the common ones are like, if you put a phone in your bra, you end up with breast cancer. I mean, there's no evidence to support that myth. Okay. Some say even the under wire of the bra can cause breast cancer. They can cause some discomfort and pain, but there's no evidence showing that it can cause breast cancer. Okay, so maybe Dr. Gite can.
Yes. Let's exhaust breast cancer. Some of the myths that you've encountered, in your practice.
So men don't get breast cancer. That's a myth.
That's a myth.
Yeah.
Yes.
I always thought that was a reality.
No, it's not.
So I wanted to believe it was.
So the self-breast examination does not exempt them. If a man feels a lump, it's even more urgent for them to get tested than a woman. A woman has a lot of space for the lump.
I don't think
Thank you for leading the way.
On camera, nothing good.
So if a man gets a lump, it's even more urgent for him to get it tested than the woman. Because the woman has a lot of fat in the breast that, there's still space for the lump to grow. But for men, it's there's no much. So the lump might likely metastasize faster.
I'm glad you're having to say that word.
So it would spread faster than a lump in a woman because it's closer to the muscles, the chest wall. So it's even worse for a man. But luckily for the guys, it's just 1% of the guys that get this. So 1 out of 1,000 is it? That's what the statistics say. 1,000 men, only one would get breast cancer. Unlike the women, where 1 in 8 in their lifetime would be diagnosed of breast cancer.
Well, there doesn't seem to be that many myths.
So there are a lot. There's a whole list of myths. Yeah, another one is that traditional medications can solve it. I've seen this in practice. They start going to the traditional healer. Especially if they come, they get scanned and they're told it's cancer. A lot of people, their denial, the way they deny this is saying, okay, you guys are saying I have cancer. That cannot be true. Let me go elsewhere. So they go and they start applying herbs. I've seen this so many times. It's distressing. So they put herbs and then the lump is starting to go. The herbs bring in infection. And the infections make it worse. Now you don't only have cancer, you also have a breast infection. And that can cause sepsis, that can cause so many other things. Because if you start applying or scraping off your skin and applying herbs on it, the lump would come out faster and spread to the skin. Oh, wow. Yeah, so it's just unfortunate. And the other one is boring. Like if you're breastfeeding, you cannot get cancer. And then the cancer is only for old women. There is a whole list of myths that are associated with it. So what we just encourage women is that they should come on time. And then it's okay to be shocked. It's okay to be in denial, but traditional medications do not cure breast cancer. I wish they could. That way we'll all go there. It's easier for us to say, okay, just take this herb and then it will go away. We wish we had that cure in Gambia so we can share with the rest of the world. If we saw changes, like somebody had breast cancer and took and they got healed, Dr. Roberts, I would refer patients to the traditional healer, but that's not the case. Usually it gets worse with breast cancer. Another thing I want to add is with cervical cancer, it's an infection that causes it. So they have a higher chance of eliminating it. In high-income countries, they're not talking much about cervical cancer. It's low and middle-income countries that are still struggling with cervical cancer. They have a vaccine, and it's an infection, it can be eradicated. If you eradicate the HPV, most of the time it's HPV. If you eradicate that, you have a high chance of surviving it. In 10 years, we'll probably be saying, thank God, we are now like high-income countries, or less. I hope it's less, Dr. Jaju. I hope it's in 3 years we are talking about. So they have a vaccine, and they can eradicate it. Breast cancer has no vaccine yet. So we are still counting on our go-to early detection. We are still talking about early detection. That's what we can count on for now. So in the world, people are talking about other cancers now because breast cancer is the leading cause of death in the world for women cancers. But here, you know that cervical cancer is leading breast cancer in the mortality. Yes.
Oh, wow, that's scary.